Dr. LeBlanc, you mentioned a little bit that sometimes you talk people out of getting veneers and lumineers, in order to get their cosmetic look, because people don't really realize that they might not need it. Deep bleaching might be the thing to do. Now, there are a couple of ways of bleaching. People can go over the counter, buy $20, $30 kits, wear them for a long time. People can go and get bleaching kits in your office or in any dental office, wear them for not as long as over the counter, but still wear them. And people can go and do that laser or whatever it is, those Zoom bleaching, which takes half an hour, an hour. Tell us a little bit the differences between all of them, the reasons for the existence of all of them, the pros and cons.
Right. There's really no cons to bleaching whatsoever, and people ask me that. Not a day goes by that I don't get asked that question. Does it hurt the teeth? The answer is no. The reason for that is there's no acidity to it. Teeth are rocks, and they're very hard rocks. So if you're utilizing something like that that doesn't have any acidity to it, it's not going to hurt the teeth. So what's the difference between something over the counter, something in the office? The strength of it would be the biggest difference. What we use here when we do our 1 hour bleaching, it's a very potent bleach. The bleach is penetrating inside the tooth. These are not surface stains. These are deep inside the tooth stains. We get them started with that, but we also go with the trays, the custom-fitted trays that we can make in the office. They're going to fit over your teeth better than something you get in a drugstore. They just are. And then the materials that we give you with the custom-made trays that fit only your teeth, they're just more potent. It's a more potent bleach. Remembering that teeth are rocks, basically, it takes time. The bleach has to penetrate deep inside the tooth. So you're knocking at these stains day after day after day. So I like to look at it that our Rembrandt bleaching machine that we have here at Portola Dental, that gives them a real good head start. And sometimes it gives them a great head start. But I still ask most of them afterwards, let's just try the trays for a while and see if we can get it even a little better. And we've had some just phenomenal results with bleaching. It can just change the way people feel about themselves. It's great stuff, and it's easy.
So a person doesn't hurt himself doing a over-the-counter thing. No. It's just he probably has to wear the tray a little longer, lots longer maybe, meaning many more nights or whatever. And maybe some of that gluey stuff comes out because the tray doesn't fit as well as the one a dentist makes, and that may be uncomfortable. But rather than that, it is not going to hurt. He might get results, and if it's a slow, long process, just fine maybe, and it gets it faster. So for instance, me, the guy who's like constantly, I don't know, hypo, call it whatever you want to call it, I would, that's why I, for instance, would go for a veneers and lumineers to straighten out some of my teeth instead of going to an orthodontist, because, I want it kind of tomorrow. And that's but at the same time, that does not mean a guy who says, that's all right, I run around with braces for a couple years or a year, whatever it is. Same with the tray. Basically, they both do the job. But the point is, a whitened tooth is obviously beautiful. Now, let me ask you, if a person does this tooth whitening, be it in the office or be it over the counter or that machine, can he or must he do it again, like a year or two down the road? Or is it like heart surgery where you do one or two and then you kind of, nope, that's it, you cannot do anymore? How does that work?
Yeah, great question. Yes, there is some maintenance to it, but the maintenance is easy. And this, I don't think I've ever read this in the book, so here's the theory I have on it. Remember a few moments ago I said teeth are like rocks, but they're porous. The bleaching materials get into the microscopic tubules of the tooth, and then they leach out the colors. The bleach does this. So you do the 1 hour bleaching, then you do the trays, and over a certain amount of time, you really get a great result, let's say, and you've got white teeth. Well, then what are we going to do then? We're going to go out, we're going to have a blueberry pie. Gee, I'd like some coffee with that blueberry pie. And the teeth will get a little discolored again. And of course, a little bit red wine with the steak before the blueberry pie. Gotta have the steak. So now we've got the teeth darkening up again. But doesn't it make sense that this is more superficial? So that's my theory. Now, here's why I think that theory holds. You can have someone that's bleached their teeth, and they get lazy, and they haven't used their bleach tray in 6 months, let's say. Well, now they got a wedding to go to, and they want to be the toast of the pictures. They put that tray in, and I could use myself as an example. If I haven't bleached my teeth in 6 months, I can put my tray in, and in a half an hour, it's just whammo, just as good as it's ever been. So that's why I really think that once you get them as white as you can be, the maintenance is easy. People do it maybe once a month, once every couple of months, or whenever they feel like they're going to get their picture taken. So the maintenance part, there is a maintenance part to it, but it's very easy.
Beautiful. And one more question. Do you have... especially I assume with the one which you do in the office, with the machine, right. But maybe with the other one, yeah. Do you have some control over how white you want to get them? Because not everybody nevertheless wants bedsheet white teeth, so yeah. Do you have control over the shading?
Well, Helmut, believe it or not, I've never had anyone say my teeth are too white. I'm going to go have some coffee later today and some wine and whatever to darken back up again. That's never happened in 23 years.
Dr. LeBlanc, are you trying to tell me I just asked a very stupid question again?
Well, here's the thing also, and I've told you more than once how I'll talk people out of veneers. And into bleaching, or at least try the bleaching and then see how they feel about their teeth.
Right.
There is nothing man-made that looks as good as enamel. There just isn't. Are the ceramists absolutely brilliant and unbelievable artists? Yes, they are. But under different lighting, if you've got beautiful teeth and you bleach them, there's nothing that looks more brilliant than that we can put in our mouths. So bleaching is fabulous. Now, if you have somebody with big spaces in teeth and broken, of course veneers and crowns and whatnot is the only way to go. Because they need more of a fixing. Some people's teeth are from tetracycline stains and certain types of stain. You can't bleach them as white as they want to. So then again, we have to go with the veneers. But the bleaching's fabulous. But back to your question, let's say someone has a couple of crowns. We don't want the teeth any whiter than those crowns, or we'd have to replace the crowns. So then yes, certainly we can do it at a rate where we can get it to the color of the crowns and just stop. And then they just have to maintain that color.
Got it. So it is scalable.
It's scalable, yes, Helmut.
Thank you very much.
You're very welcome.